Hello, my name is Mackenzie Radcliffe, and I am a student nurse at Wenatchee Valley College. And today we'll be going through an insulin medication administration with you, and I will demonstrate how to mix clear and cloudy insulins based off the case scenario provided by our clinical instructors. Our case scenario begins with Catherine Weber. She's a 53-year-old female admitted to the acute care unit diagnosed with type 2 diabetes. Patient has just finished eating her breakfast. It is 0800 and her PCP has just written the following orders. NPH insulin 12 units daily at 0800. Do fingerstick blood sugar and give correction Lispro insulin subcutaneous based on medium dose protocol sliding scale. Carbohydrate count after meals. Give prandial Lispro insulin subcutaneous 1 unit over 15 carbs intake at meals. Alrighty, so looking at these orders and keeping the test case scenario that she has just finished eating her breakfast. Doing my calculations, I have 12 units of our NPH, which is going to be represented by this here with the proper label affixed to it. I had to get creative with my props. And then we have our insulin Lispro, which we will have to do some calculations on our carbs and also look at our sliding scale provided by our provider. And that will be represented with this prop here, which has the correct label on it. Alrighty, so we need NPH insulin 12 units. So if I'm going to be giving correction Lispro insulin, I would show you, but I'm having difficulties turning around my camera. So I will just verbalize. So fingerstick blood sugar was obtained at 241. So I'm going to go over to 201 in the 250 range in my serum fingerstick blood sugar column, and I'm going to slide over to the medium dose. And I see there are 6 units of insulin Lispro. So for my correction insulin, based off the fingerstick blood sugar obtained, 6 units of insulin Lispro so far. But she also just finished her breakfast. And we are provided with a patient tray that shows 2 eggs scrambled, 100%. Apple juice, 15 grams, 50%. 1 slice of bacon, 100%. English muffin, 50%. Which is 30 grams. Banana, 30 grams, 75%. Coffee, black, 100%. So we are not going to count our coffee or the eggs or bacon in our carb count. We are only going to include the apple juice. So 50% of the apple juice at 15 grams would be 7.5 grams. 50% of a 30 grams of English muffin would be 15 grams. And we have our banana, 30 grams. 75% of a 30 grams is 22.5. So if we add our 22.5 and our 7.5 and our 15 grams, we're going to get 45 carbs altogether. And based off our order, we have 1 unit over 15 carbs. So doing our math, 1 unit over 15 carbs times 45 carbs, we're going to get 3 units of insulin Lispro for our prandial to account for the elevations in blood glucose that occurs after eating a meal. So if I'm going to mix these in a syringe. So I have 12 of the NPH. I have 6 units of insulin Lispro off the correction sliding scale, and I have 3 units based off the carb counting. So I'm going to have 9 units of insulin Lispro, 12 units of our NPH, and altogether we will have 21 units of insulin. Alrighty, so we will begin with our supplies. I'm going to be making sure that I'm checking the vials to the MAR here. And before I even began checking the vials and going through the counts. I've already gone in the room, performed hand hygiene, introduced myself, verified the patient's identity with 2 identifiers by having them verify their birthday and their full name, and I've checked their identification band. So I'm now checking the vials to the MAR, and I'm checking for expiration date, while I'm also checking for any cloudiness, precipitate, frosting. With our NBH, it's very important that we roll to prevent the clumping of the aggregates in there. We never shake because this can cause air bubbles that can cause inaccurate dosages. We are going to repeat the same procedure with our Insulin Liz Pro. Expiration date, checking to the MAR, any frostiness, clumping, clouding. This should be clear. This will be cloudy. So we're going to mix from clear to cloudy. I'm going to kind of tilt down for this next part. So we are going to take an alcohol swab. We're going to clean the top here. We are going to take our insulin syringe. I've created my own insulin syringe prop. They're typically orange and they come in units. We only use an insulin syringe for insulin administration. Take off the top and draw back 12 units of air. Inject in, ensuring that the end of the needle is not going into the insulin NPH, as this can cause cross-contamination and we'll need to restart over again. Inject the air. Draw back 6 units. Inject the air. But this time, we are going to invert the needle and pull back our 9 units. 9 units altogether. So I would have aspirated 9 units injected. I'm going to pull back 9, ensuring there are no bubbles. You can flick the vial. I'm going to have my second RN come in verified dosage, which is going to be represented on that first insulin syringe. We are then going to inject into our NPH, invert, pull back all, there should be 21 altogether, checking for bubbles, having our nurse verify, and you will see that on that top one that's filled out there. She's gone through the carb count already and verified our dosages for each. She has confirmed. We recap safely. Today, my patient has chosen their abdomen to be the site that they will use. It is the best source of absorption. We're assessing for skin integrity. We're making sure that we're rotating our sites. Applying gloves here. We're going to inject at a 45 to 60 degree angle for our smaller patients and a 90 degree for our larger patients. She is going to be a 90 degree angle today. We will take a fresh alcohol swab that I do not have, vigorously scrub. I'm going to check my MAR again. That's my third check. We're going to remove the cap. Pinch the skin, insert it like a dart, inject, release. We're making sure that we're not massaging the area. We're recapping safely, and we're throwing away in a sharps container, which is going to be this. Alrighty, that is my demonstration on mixing from clear to cloudy and working through the case scenario with you today. Thank you.